coming back to the ZeroFive100 project, I know two of the participants were type 1. So looking at your results, I think the most fascinating thing for me was that you were functioning fully, both physically and mentally, on lower blood sugars, which most diabetics would regard as, I don't know, as a hypo or dangerously low blood sugars. But you were perfectly normal, you were alert and physically energetic at low levels. So how did that happen? Because I experienced that I could go the whole day on low levels, which in fact my Libre registers as hypo, but I know I'm not having a hypo. I'm fully alert. I'm not having a hypo. I'm not experiencing any hypo symptoms.
Yes, I mean, the brain runs quite happily on beta hydroxybutyrate, which is the common ketone body, which is used for neuronal tissue. So, I mean, I've experienced also that I still have good hypo awareness, but it's often a little bit around just under 3 millimoles per liter. And of course, the traditional concept of hypo is a 3.5 and less. But one of our people with no diabetes, she spent a third of her time, well, 30% of her time, with the blood glucose below 3. That was measured on a CGM, continuous glucose meter, and she also checked her, sort of calibrated her CGM against a finger prick test. So it was reasonably accurate, we think, and she spent a third of her time below 3 and had no symptoms whatsoever. So we think you can run a little bit lower. However, it's difficult running a diabetes clinic because there are some people who with advanced diabetes and others who have got, you know, there are lots of different types of type 1. There are probably several different causes of type 1. And some people might have less ability to rescue hypos because they haven't got any alpha cells as well as beta cells. So they don't produce as much glucagon as they should, compare and insulin as well. And it may be that some people do have genuine hypo unawareness. I mean, I can run low, but I still have hypo awareness. So for me, I'm not about to just sort of go unconscious. But there are others who have very poor awareness of their hypos, and then it makes it a difficult call, doesn't it? A difficult judgment call. So why would you want to drill it right down if you're not aware of your hypos? It's just putting you at risk.